hello everyone, and thanks for that really nice introduction. As the speaker mentioned, I'm here to talk a little bit about our social and behavior change toolkit that we're developing in collaboration with Sight and Life and UNICEF and local partners to introduce MMS appropriately. When we think back to iron and folic acid, although certainly a good nutritional product on paper, it's faced a lot of implementation related challenges. And now that we have multiple micronutrient supplementation that is more efficacious for improving maternal nutrition and improved birth outcomes, we want to, or we've been trying to strategize how can we avoid the same fate that IFA has seen. And one way is to develop a social marketing strategy when we introduce MMS, and the social marketing strategy or the social marketing framework usually takes the 4 Ps approach. First, focused on the product. So how can we change some of those product related characteristics to make it more acceptable to community members? Number 2, how can we modify, if at all, the price? And that might mean the actual cost, but it also might refer to opportunity costs, such as traveling to a health center to pick up a product. The 3rd P refers to the promotional aspect of the product. How can we develop and tailor communication channels? What audience segment should we reach so that MMS can be promoted appropriately? And finally, how do we place this product within any nutrition program? How we place it in Burkina Faso might be different than how we place it in Madagascar, for instance. And so understanding whether a community or a facility-based approach is appropriate for a given context, or what combination thereof is one key aspect we think that will be important for promoting MMS, so that it, again, doesn't face that same fate that IFA has with low coverage and suboptimal compliance globally. So to do so, what we're trying to do is really help country offices through 3 main pillars. And the first, I refer to as an aim here, is really to identify those product-related factors that will make MMS more, give it some more value. Number 2 is to how do we generate these culturally appropriate promotional strategies, and not just culturally acceptable, but culturally appropriate, so that they resonate with community members and there's value that we have provided on top of the nutritional adequacy of the product. And then number 3, what are the modifiable factors through formative work that we can change to create an enabling environment for optimal behavior change? And so we're developing this toolkit to be used globally that draws from rapid assessment procedures, sometimes referred to as focused ethnographic study designs. And they take a number of different research methods, largely qualitative and ethnographic, that are meant to be conducted over long periods of time, in the past by anthropologists for months and months and even years, and boiling them down into a systematic approach that can be conducted in the context of programs where timelines are tight and resources are sometimes limited. So we're developing this global guidance with partners in 4 different country contexts, where we're introducing the MMS as part of the demonstration pilot. And right now we're in the process of drafting and getting feedback on the guidance manual that we've developed, so that it can be better and more useful moving forward as a global toolkit. And I'll take you through the 3 phases of that toolkit very quickly. But the first phase, we've included market observations, product design, community workshops, as well as focus groups to be the first pillar that will inform our social marketing strategy. And we start with the first research question, which is, what are other locally available nutrition products in use and being preferred by people in market X or market Y? Here are a couple of different pictures from Bangladesh and Tanzania and Madagascar, where we've already found similar types of products on the market, and we're trying to draw out what are the most preferred aspects of these products to inform the current strategies in the demonstration pilots in these settings. Number 2, we're interested in those product-related factors. So for a lot of specialized nutritious foods like MMS, we have the opportunity to modify the box, to modify the logo, sometimes to develop culturally appropriate or locally contextualized name. And let me just go back here. Here are a couple of samples that we designed with UNICEF graphic designer at headquarters as samples that we're taking to the field right now to solicit feedback in the 4 different country contexts. We're also interested in what are those social norms around prenatal supplementation, not just around MMS, but around foods and supplementation during this important life stage. We'll take those findings and in an iterative approach, use those to inform phase 2 data collection, which really dives more into the ethnographic analysis. And so we've built in a couple of simple activities or research methods drawing from cognitive anthropology. And free lists and pile sorts are 2 such methods. They allow us to first understand items within a cultural domain. And so for instances of this, or for this project in particular, we're interested in identifying health and nutrition terms that are local to each context and that can be used for promotional purposes when we promote MMS. We're also interested to learn about the level of risk perception towards nutrition-related illnesses. What we as nutritionists think is important is not always the same as what community members think is important. And that's quite important when it comes to social and behavior change. And then finally, phase 2 should give us really the tenets to inform a social behavior change strategy. And that includes communication channels, audience segments, and then tailored messages that can be used to promote the MMS for positive maternal nutrition and improved health outcomes. So these 6 methods are put together in a strategic way that they can be completed in just 2-month time period. And for most programs, we think that's an adequate amount of time that will yield useful information, but at the same time be practical enough to be completed in the field. Then we build in some time where we can develop and take those findings and develop strategies that will be used in a subsequent household feeding trial. And we call this phase 3, which is our household trial of improved practices. And for those of you familiar with public health behavioral interventions, a TIPS, as it's called, is sometimes used before scaling up a behavioral intervention. And in doing so, in this small scale trial of improved practices, we can figure out what are the barriers and facilitating factors to that consistent supply and demand and compliance with MMS before investment into district level, regional level, or even national type of programming. And if you look at our overall research timeline here to develop SBCC, it's really not too long. We hope it's manageable. And really this toolkit should be used, or it's being developed so that it can be used by practitioners on the ground, not by big research institutions or universities. So in summary, our toolkit's drawing from rapid assessment procedure approaches or focused ethnographic studies. And there are a number of these out there already. If you look on the left side of this slide around different types of public health behaviors. And we're crafting ours with partners to try to specifically develop a social marketing strategy for MMS. And if we have a nice social marketing strategy for MMS in any given context, we expect greater demand, we'd expect higher compliance, and then most importantly, improved maternal nutrition and birth outcomes. This is a toolkit that's in progress right now, and I'm happy to talk about it at length and provide some different examples about findings that we're getting from the field already in Burkina Faso and in Madagascar and Tanzania and in Bangladesh. So thank you first and foremost to our study participants, as well as to our formative research partners on the ground, helping us carry out this field work during COVID. Of course, our government counterparts and our UNICEF colleagues at headquarters and country offices are invaluable in this process of toolkit development and formative research. And then thank you again to Site and Life team and the Penn State team of both strategic and technical partners who are helping with data analysis and helping take those findings to inform this toolkit, which we hope will be useful to the global community. Thank you.